So after you have your baby, there's a lot of changes that go on in your body as you're returning back to the normal non-pregnant state. And there's some sort of specific issues about your physical care that's going to happen the first day or two after delivery. One thing is that your uterus starts off as big as a baby, and that's going to shrink down back to normal size again in the course of 6 weeks. In the hospital, there's going to be a lot of cramping as the uterus starts to cramp down. And if you're breastfeeding, you'll notice that when you put the baby to the breast and it first starts to breastfeed, those contractions are going to be worse. And it's supposed to be that way because there's a mechanism in your body that a chemical gets released when the baby starts to suckle that tells your uterus to contract. Your body's all wired that way. It's designed to do that. So that's normal and you can expect that. For those kind of contractions, I find that ibuprofen or Motrin really works better than even narcotics for that kind of pain. So that's what you want to think about using for that type of pain. Now the other thing is that your vagina has just delivered a baby and it's got to get back to normal. In some cases there may be stitches or tears that are healing as well, and that can be quite tender. And so some of the things that you're going to want to do differently is when you use the restroom, instead of wiping with toilet paper, that's going to hurt. They'll give you a little bottle and you can squirt the area clean with a bottle instead. And you will take that home. You can also do what's called sitz baths, which is basically sitting in a tub and soaking with water, and that can really help. There's also other things that can be put on, something called witch hazel, tux pads. These are all things that can be put on the vagina to help soothe the vagina. The other thing that's going to happen is that the breast milk is going to come in. Sometimes it takes a couple days for that to come in. And if you're breastfeeding, you're going to be working on teaching the baby how to get milk out of your breast. And sometimes it can make the nipples to be pretty sore. There's a cream called lanolin cream that can help a lot with the changes on the nipples, particularly with breastfeeding, to help make that more comfortable. So these are things that you can ask your nurse for in the hospital and they could provide for you to make your time more comfortable. This is also a very good time to get help if you need help with breastfeeding. Most hospitals have what's called a lactation consultant, which is somebody that can come into your room and really give you one-on-one attention and help you with some of the challenges that may occur with breastfeeding. So these are some of the things that are going to happen to your body while you're in the hospital after having a baby.